Hi, my name is Anna. I will be your nurse today. I'm going to get a health history um, from you. So I'll be asking questions about you and your family, your wife, your kids, your parents, for example, anything that tells me about the health of you and them. So if you don't mind, I'll have quite a few questions for you today.
Sure.
All right. Can I start out with your name and your address?
Steve Young. My address is 206 Mercy Street, Bethel, Missouri, 63434.
All right. And Steve, how old are you?
42.
And when was your date of birth?
10/17/1976.
Okay. And what? Where were you born? Where was your birthplace?
Parkersburg, West Virginia.
All right. How did you get to Missouri, Steve?
Um, Came to college.
Okay. All right. And what is your gender?
Male.
And are you married?
I am
All right. And what is your race?
African American.
Okay. And do you have a specific culture that you identify with or ethnic group? Okay. And what is your religion? Do you have a religion?
Catholic.
Okay. Are you active in your church?
No.
Okay. And what do you do for a living? What's your job?
I'm an accountant.
Okay.
CPA.
All right. And what kind of health insurance do you have?
NBH.
Okay. Great. So what brings you to the doctor today, Steve?
I've been having a little bit of chest pains that I just missed as indigestion. They progressively got worse, and my wife insisted that I come to the doctor. When I did go and see the doctor, they told me that I had suffered some heart
Okay. Okay.
damage. Going on.
Did they prescribe you any medications for that? Are you taking any medications?
No.
Okay. Do you take any over-the-counter medications?
I have migraines sometimes, and usually over-the-counter stuff takes care of it.
Okay. What kind of over-the-counter medicine do you use?
Ibuprofen.
Okay. And how often do you take that?
Very random.
Okay.
A couple times a month.
All right. And do you have any health concerns today?
I just would, of course, my heart.
Okay. Are you up to date on immunizations?
Yes.
And are you taking any herbal, natural supplements? No. Okay. And do you have any allergies?
No, I sneeze when I mow the grass.
Okay. But nothing to food, drugs, or latex?
No.
Okay, thank you. Do you use tobacco?
I smoke about a pack a day.
Okay. How long have you been smoking a pack a day?
15 years.
Okay. Have you ever thought about quitting?
I've tried several times. Never worked.
All right. Well, we'll see what we can talk about that later. See if you're up to trying that again. That will definitely help with your heart health if you could quit smoking. And do you use alcohol?
2 or 3 times a week.
Okay. What kind of alcohol do you drink?
Beer. A couple beers.
Okay. All right. Of course, stopping drinking would also be something that you may want to consider for your heart health. Do you use marijuana?
No.
Any street drug use?
Never.
Okay. And so tell me about your family, Steve.
I'm married to my wife, Angie. She's 40. I have 2 kids. Kelsey is 7. Marcus is 6. And my wife is pregnant right now.
Well, congratulations. And so is that all that's in your immediate family then? Do you have any adopted children?
No.
Okay. And who's the head of the family?
Me.
And who makes the healthcare decisions for your family?
Me.
Okay. Is there any rules for your family or your for you about the gender of any healthcare professional that would take care of you or do your assessments?
No. Thanks for asking.
No problem. All right. So to ask a little bit about the health of your family, is your wife healthy?
Yes.
Okay. And do your children have any health concerns? Do they have any diabetes or?
Other than my little boy getting hit by a car, no.
Yes. Well, that's definitely a big one. Does that add a lot of stress to the family?
No.
Okay. Do you guys have a good support system to help you with that?
Yes.
Okay. Is your mother alive?
Mother and father are both alive.
Okay.
Both healthy.
Okay. With your parents, is there any history of heart disease, coronary artery disease, hypertension, diabetes?
No.
You may or may not know this. Do either one of them have high cholesterol?
No, they told me I did.
Okay. Okay. So both parents are in good health with no major health problems then.
Correct.
Okay. Well, thank you. All right. Well, that is what I have for your health history concerning the family. And then what we will do, I'll ask you a few questions about your health history concerning your body parts. Do you have any concerns skin-wise? Do you have moles?
No,
Any?
I have flaky skin. That I use dandruff shampoo to keep from.
Okay. Does that help?
Yes.
All right. Any problems with your nails? Okay. How about your head and neck area? Do you have swollen lymph nodes,
No.
sinus problems?
No.
Do you have a regular eye exam?
Yes.
Do you have all your real teeth?
I do.
And do you see a dentist regularly?
I do.
Do you ever get sores in your mouth, anything like
No.
that? Any trouble with your hearing? Do you wear hearing aids?
No.
Okay.
Good vision.
Okay. No sore throats? No history of sore throats?
No.
Okay, and then respiratory system. Do you get colds regularly? Do you have any congestion, heaviness, trouble breathing, shortness of breath?
No.
Okay. And heart. Have you ever had heart palpitations, irregular heartbeat?
Not that I'm aware of.
Okay. And then your blood pressure. How is your blood pressure doing?
I don't know.
Okay, so that'll be something we will want to check out and keep a record of. Do you have any numbness or tingling in your arms or fingers? Any coolness in the hands? Okay. Any trouble with your stomach, your abdomen area? Any pain, tenderness?
No.
Any bulging that you've noticed?
No.
And do you use the bathroom regularly?
Yes.
Are your bowel movements daily? How many times a day?
Maybe 3.
Okay. Are they hard or soft?
Normal.
Okay. And what color are they?
Light brown.
Do you have any problems urinating?
No.
Any burning? Any burning with urination? Any
No.
bleeding? Okay. Is there any tenderness in the reproductive organs like the scrotum?
Nope.
Okay. Any trouble with your muscles? Do you have any muscle aches or strained, pulled muscles?
No.
Any muscle cramping?
No.
Any joint pain or stiffness? Okay, and then you said, is there any numbness or tingling in your feet? And you said no in your hands as well. All right. Well, Steve, I will put this in. I thank you for your honesty and openness. Do you have any questions for me at this time? All right. Well, very nice to meet you. Have a wonderful day.
Thank you.